Receiving specialist medical treatment in regional areas is difficult at the best of times, but the COVID pandemic has made such access harder than ever before. A lack of commercial flights too means that demand for specialist medical transport has skyrocketed, with one not-for-profit organisation in particular doing its best to fill the void.
The skies have been sparse since the pandemic began, but if you look closely enough, you might see one of these. It's a Little Wings flight, and they come and go from Sydney a number of times a day, continuing to deliver precious cargo, children in need of life-saving treatment.
Prior to COVID, we were doing between 12 and 15 flights per week, but now we're seeing as many as 28 flights in a week. And I suppose it tells us that the demand is there, but it also means that there's a lot of families that aren't getting the support they need.
10 volunteer pilots work around the clock to help ease the strain on regional health services. They may be small, but they're determined, and they've helped 1,000 children receive medical care in the past year alone.
Words can't even bring it to it, how great it feels to be able to help and see the families get the care they need.
After a refuel and a pilot change, we climb aboard for the next leg of the journey.
Let's do it.
You got this?
It's mid-afternoon, but there's still plenty more to do. Little Wings services 55 regions across New South Wales and the ACT. So this six-seater Beechcraft Baron covers a lot of ground.
Since the beginning of the pandemic, Little Wings has actually expanded its service, not only transporting families to and fro the city, but also taking doctors out regional too. So we're on our way to Tamworth now to pick up a specialist ENT, and then we'll take him to Dubbo so that he can treat some patients.
400 kilometres and 60 minutes later, we touch down in Tamworth. Dr Ranga Sirigiri is ready for his lift. Previously, he was driving several hours between regional towns to treat patients in need.
This is very vital, especially for the regional patients and the regional specialists, where you don't have access to the commercial flights.
Transporting specialists is now a pillar of the Little Wings service. With commercial flights on the back burner, it's become a fast and free alternative for dozens of health workers.
The number one thing it brings for us and our patients is certainty. It's knowing that we can actually run these clinics and there's not going to be hiccups, we're not going to have to cancel.
The sun has gone down by the time we reach Dubbo, where the Talib family is there to greet us. Their son, Akil, born with a club foot, needed major surgery, only available in Sydney. The family had been driving 7 hours each way for consultations.
When my wife and my son returned back home, everything arranged with Little Wings. My family turned back home safe, happy, and everything went well.
I'll see you soon.
Thank you so much.
Another family who've been helped by a service connecting the regions to the cities, all in a day's work. Amelia Dunn, SBS World News.